All right, time now for our healthy living segment on More in the Morning. Skin cancers often start as our skin begins to change. And board-certified family nurse practitioner at Florida Coastal Dermatology, Gia Edge, is joining us live this morning, getting us more on how to spot skin cancer. Gia, thank you so much for waking up early and joining us.
Thanks for having me. Morning.
Good morning. And the first question we want to talk about is, there are probably a lot of signs, especially living in Florida with the sunshine pretty much the entire year. And there are some signs that people should know about when they're trying to determine whether or not they think they might have a form of skin cancer. What are some of those signs?
All right, yeah, so great question. There are things that you can do at home to start detecting any changes in your skin. So the first thing is self-skin exams. This will really help you just become familiar with your skin, with the moles that you have, and then that way you can determine if you've noticed any changes or anything new. I like to tell my patients about the ABCs. That really is helpful when you're determining if anything has changed. So A for asymmetry, B for border, C for color, D for diameter, and E for evolving. And what this means is if you have a mole and you were to fold it in half, does it look the same on each side? Is it asymmetrical? Are the borders regular or are they irregular? As far as color goes, is it a nice, smooth, even color? Or are you seeing that the mole is darkening? Are you seeing additional colors such as tans or browns or bits of black? You could even see red, white, blue, or purple. As far as the size, in melanomas, they can be 6 millimeters, which is about the size of a pencil eraser, but don't let that fool you. They can be smaller as well. And then evolving, which is really the thing that brings most patients in. Either this mole has changed or this mole is new, it's bleeding, it's not healing. These would be all reasons that you would need to be seen by your dermatologist.
And that really leads us into our next question, which is, those are ways for you to examine at home, but then how often should you actually consult your dermatologist? Is it really just on a case-by-case basis, or is this something you should consult every couple months?
Yeah, and that's a great question. So the self skin exams are wonderful in adjunct to getting a skin exam by a provider at your dermatology office. So if you have no history of skin cancer, you still should be getting that skin exam once a year, regardless of the color of your skin. Everybody is at risk for skin cancer. 1 in 5 Americans will develop it in their lifetime. If you do have a history of skin cancers or lots of pre-skin cancers, we will recommend that you come in at least every 6 months for a full skin exam.
And you saw the locations listed there right on your screen. One is in Naples there for Florida Coastal Dermatology. I want to thank Gia Edge for joining us this morning, talking to us about making sure you're doing those at-home checks and then also consulting your dermatologist about skin cancer. Skin cancers often start as our skin begins to change. And board-certified family nurse practitioner at Florida Coastal Dermatology, Gia Edge, is joining us live this morning on More in the Morning, getting us more on how to spot skin cancer. Gia, before we get started, just want to say thank you so much for getting up early this morning.
Thanks for having me.
And the first question we have for you here, so a lot of the times, especially living here in Florida, everybody's outside most of the time, whether or not you're a seasonal resident, you live here full time, or maybe you're just here to vacation. But I'm told that there are some signs that people should look out for, some things you could do at home to look out for maybe some skin cancer developing. What are some of those signs?
Yes, so absolutely. You can be your own best advocate sometimes. A at-home self-skin exam is a good thing to do. I encourage my patients to look over their skin, to become familiar with it, to know what moles they've had or if they're changing. So when you're at home, you can stand either in front of a large mirror or even a handheld mirror is fine and look your body over. This will really help you to determine if you have anything that's new or changing. I like to remind people of the ABCs. So that would be asymmetry, border, color, diameter, and evolving. What that means is if you have your mole and you were to fold it in half, would each side be equal? Would they look alike? So if they're not symmetrical, then that's a problem. If they have irregular borders, that needs to be looked at. As far as color, if it's not a nice even color, and you start to see any changes, brown, tan, black, even red, white, blue, and purple, these are concerning changes, and these would be things that need to be looked at. If you notice that it's growing or changing, if all of a sudden an area becomes tender or is bleeding, or it's just not healing, these are all reasons to go and see your dermatologist.
And you bring up the dermatologist, that's actually leading me into my next question, because is this something that is a case-by-case basis? Maybe somebody notices that they have a irregular spot on their skin somewhere, and that is going to lead them into the dermatologist? Or is it important to schedule an appointment maybe twice a year, once a year? When's the best time to check in?
Great question. Anytime you notice that something is new or changing, you need to make an appointment. As far as a full body skin check, that should be done once a year. No matter what your skin color, everybody needs a head to toe assessment once a year. Now, if you're somebody that has lots of precancerous areas or you've had skin cancer, you will need to be seen at minimum every 6 months.
Of course, if you're living here in Florida, you said a head-to-toe exam. We have the sun all year round. So definitely an important thing to get in touch with your dermatologist. Always want to thank Gia Edge joining us this morning, Florida Coastal Dermatology, Florida Coastal Dermatology, talking to us about what you should do and what you should be on the lookout for when it comes to skin cancer.